You've likely heard of a condition called shock, and you may have seen characters on television go into shock after experiencing emotional trauma, but you may not know what this condition actually is. In truth, shock is a condition in which your body is unable to effectively circulate blood. It is a serious medical emergency that can cause tissue and organ damage and death. In general, there are 5 scenarios that can lead to shock, and no, emotional trauma is not one of them. That's a Hollywood myth. The first scenario is low blood volume. That is, you do not have enough blood in your body. This, of course, is caused by sudden blood loss. The second scenario is damage to the heart itself, such as cardiac arrest. If the heart cannot pump properly, then of course it cannot effectively circulate blood. The third scenario is obstruction to a major blood vessel. This might be caused by a blockage in the vessel, or from pressure outside the vessel, such as that caused by a sucking chest wound. The fourth scenario is excessive vessel dilation leading to low blood pressure. This can be caused by infection or allergic reaction. The last scenario is excessive vessel constriction, preventing sufficient blood from reaching your tissue. This can be caused by exposure to cold. A person suffering from shock will experience weakness, fast heart rate, fast breathing, sweating, cold, clammy skin, confusion, and fainting. If a person at risk for shock develops any of these symptoms, you must treat for shock immediately. To treat, first handle the scenario that is causing the shock. If a patient is cold, warm them. If a patient is losing blood, stop the bleeding. After that, treat the shock itself by having the patient sit or lay comfortably. Keep them warm with a blanket, and evacuate to a higher level of care as soon as possible. Shock is best treated preemptively, so remember that all injuries should be treated for shock.